Everybody, hope you had a good weekend. Here with Josh and Paul, give you an update here in Connecticut and what we're seeing around the region and around the world. These are the numbers since Friday, so the 3 days worth of numbers. I think the relevant things to see is 72,000 tests, so we're still running at 150,000 now a week. We've just done our 2 millionth test. We are long on testing, and we think it's really important in order to constrict the spread of this COVID virus, and we're going to keep at it. The positivity rate, 1.7%. Not a good number, but not a number that's spiking up, at least over the last 3 days and longer. Hospitalizations and deaths, big numbers, 3-day numbers, but numbers we hate to see. If we're at 1.7%, you'll see later that the positivity rate in the United States of America is 5.3%. Give you a little bit of a perspective on where we are. This next chart is another eye exam for you. We love to send you to an optometrist. But what it tells you is, look, the bright red, you can see that's United States. You can see that's Argentina. You can see that's Europe. Those are 14 per 100,000 testing positive. So we are one of the most infected countries in the world. That said, if we're at 14, France is at 33. Spain and UK are, about double where we are as well. That's just a reminder because Europe was had a 1 month head start on us going back in the spring. They were doing very well during the summer, and you've seen what is spiking up there. It's worth noting that the pale colors, which is now moreover in Asia, China, as well as Japan, there the infection rates are virtually zero. You got to check the numbers, no question about it, but the numbers, the infection rates are zero. Very strict in terms of the protocols, very strict in terms of the testing, draconian in many ways, as you remember how they, locked out Wuhan province, but it has paid some dividends. And you maybe saw our Department of Labor numbers for Connecticut came out today, and they said our employment is down about 6% compared to where we were a year ago, 6% fewer people working. Moody's had said we've got about 88% of our GDP back, which is one of the top 10 in the country, but we're only 88% of the way back. One of the only countries in the world that's growing is China, and it just reminds you that public health and economic growth are closely tied together, and while we've got to get public health solved before we'll really get our economy moving, that said, we're still doing relatively well compared to a lot of our peers. The next chart is just a reminder of where we've been and what we got to do. I'll just quote from this New York Times piece, I think it was yesterday. In sharp contrast to the spring, the rituals of hope and unity that helped people endure the first surge of the virus have given way to exhaustion and frustration. And I think there you can see July 10th, we had about 67,000 infections. You see the number dip during the summer, back up to 52,000 as of October 13th. And I think you'll see the numbers as of yesterday were at 69,000, the most since that July 19th peak. And it's just a reminder how fast things can change. Look at Europe and how fast they can change in our country as well. Back in April when we were so disciplined, the favorite phrase was, we're all in this together. And now as we approach, mid-late October, you see those numbers scooting up. We've gone from we're all in this together to I'm going to sue you if you made me wear a mask. We've got to continue to maintain our discipline and get this right. That said, let me give you just a little bit of relative news. Compared to our peers, you can see that Connecticut is still one of the lowest infection rates in the country. We've gone up over the last month, no questions asked, but our country has gone up by about the same amount. The national average, you can see, is 5.3%. And you can see it's a big difference. Out there on the right-hand side of the chart, if you can't see it, I can. That's Nevada. At 35% of the people tested with that PCR test tested positive. South Dakota, Idaho, Iowa. So it just gives you an idea of how extreme this can be if we don't maintain our guard. One way we're maintaining our guard, as I've said before, is we're doing testing more per capita than almost any state in the country. 2 million tests and counting right now. Aggressive asymptomatic screening. You know what we've done in terms of the cavalry when it goes into Norwich, when it goes into Danbury, testing and then quarantine so we can contract the spread. We've had some success there. Rapid response for those spots and adding new testing platforms. We've now distributed the first 50,000 of those Binax tests. They're the ones that look like a credit card. Nurse or anybody can administer them pretty quickly. You get a response in real time. And that's one of the ways that we'll be able to test folks who are symptomatic and make sure we know whether you're symptomatic with just a mild case of the flu or COVID. That's going to be part of our rapid response going forward. We've looked at where other testing probably in and around sports, because we've seen a lot of infections in and around sports, not necessarily on the hockey rink or on the playing field, but all the activities in and around sports, which are worth remembering. That said, that's allowed us now to have over 50% of our schools, pre-K through 5th grade, open on a full-time basis. So those kids are able to get. The older you get, the more likely you are to be in a hybrid, and frankly, more likely you are to be able to benefit from a hybrid as well. So we're still continuing to make good progress on that front, but you can't count on this forever. And finally, we talked a little bit about the travel advisory. This is what we're discussing with Massachusetts, Rhode Island, New York City, New York State, and New Jersey. Two things. Right now, you can either have 10 positive cases per 100,000 or a 10% positivity rate. As you know, we're close to 40 states, and we're going over the edge on that well. So we wanted to do two things. Say, rather than 10 or 10, it's going to be 10 positive cases and a 5% positivity rate. I think that means we brought the number of states that fall in that category from over 40 down to about 33, which is more manageable. Be strict about enforcing that, make sure they test, make sure they quarantine, and hold them accountable. But because, again, you can see if it's Nevada or Wisconsin or how highly risky it is for those people to be coming in. More broadly, and Deirdre always wants me to remind people, I think it's really worth remembering, stay close to home. Stay close to home this holiday season. Stay close to home for Thanksgiving. Limit your domestic travel and certainly your international travel. You showed where those red hot spots were in other countries, in other states, and I think we'll be a lot safer for it. With that, we've got Paul and Josh here, Max, if there are any questions.
NBC, Connecticut. News 8.
Thank you, Max. Good afternoon, everyone. Governor, when you spoke about the travel advisory, and I guess with our slight uptick, we're kind of showing up on other people's travel lists as well. I guess I was almost, do you look at that as it was almost inevitable because when you compare our positivity rate with the rest of the country, but it's kind of a shoe on the other foot type of thing?
Well, we're a little tiny bit over that 10 per 100,000 number we had as one of our metrics. As Josh will remind us, we do twice as much testing as most people as well, so that skews it. Paul has been in active conversations with both New Jersey and New York, so we're not going to be going on any of their quarantine lists, and we'll work together to come up with a metric which we think is enforceable and realistic.
One of the things that I think they've had some success, particularly in New York in these real hot zones. I think Queens was one of them. Brooklyn was one. I know you're constantly in touch and comparing notes with other governors around the country. Is there something that's being done right now that you can sort of apply here with respect to them having some success, as I mentioned, in places like Queens and Brooklyn?
Well, they've been very strict about the lockdown in Queens and Brooklyn, but it also reminds you that the state-by-state quarantine is complicated. I mean, frankly, most of New York has a positivity rate lower than Connecticut, but you do have these red-hot pockets. Just like you saw on the globe, you see that in parts of Brooklyn and Queens. By the same token, Fairfield County has a very low rate, easy for them to go back and forth to New York as needed, but we've got a couple of cities that are red hot. So we're trying to adjust this as we see fit, but the closer you can stay to home, the better it is.
So I can ask you one more, Governor, regarding the kind of a regional plan with the airports, and as opposed to just people flying in from highly infected areas, are you close to something where it doesn't matter where you're flying in from, that it'll hold true for everyone traveling into the state?
Yeah, as you saw on that last chart I gave you on the travel advisory, our recommendation wherever you're flying in from is quarantine and test. But that's a recommendation. Still, for those places that have 10 per 100,000 or a 5% positivity, either or, no, both of those, then it's really important that you're going to have to quarantine, and that'll be enforceable. And I say that really to a lot of great kids who are coming back for Thanksgiving. Maybe they're coming back from University of Wisconsin or University of Nevada, and those people are going to have to test and quarantine.
Thank you.
Channel 3 Eyewitness News.
Good afternoon, everyone. When will this new travel advisory metric go into effect?
Paul's still in discussions with New York and New Jersey, so probably in the next day or two, I would think.
That's correct.
Thank you. And in New York State, ski resorts will be able to reopen on November 6th with some strict restrictions. So will ski resorts in Connecticut be allowed to open for their seasons on time?
Josh, any thoughts on that? Ski resorts?
Yeah, I believe that falls under the outdoor recreation, which is allowed to be open under Phase 3.
Thank you.
Fox 61.
Good afternoon, Governor. You touched a minute ago on college kids coming home from out-of-state colleges, and they're coming from Florida and Texas and California and Wisconsin and all kinds of places. My question is, what about their families? They're coming home to parents who work here and siblings who go to school here. Are families going to need to quarantine when their college students come home for Thanksgiving, and many will be here on through the winter?
Yeah, I was talking to our Reopen Connecticut committee and those that did the higher ed piece, and right now we're thinking about you have a 2-week quarantine before you come back to Connecticut, or else you're right. Then all of a sudden you're quarantined with your family, and they would be at a little bit of risk as well.
All right, and on the testing, our testing capabilities are very high right now, but people are still complaining that it's taking a long time. You talked about the credit card test a moment ago, but are there efforts being made to increase the availability of a rapid testing so people can get their results, quickly?
Well, the Binax test, you're going to get a result in about 5 minutes, but Josh?
Yeah, that's correct. The antigen testing platforms that are coming out, including the Binax one that we're getting deliveries from the federal government, are 5 to 15 minute turnaround time, but they're used in specific situations, particularly when someone's exhibiting symptoms. You can get them that quick result. But I would just point out again, we continue to get very fast turnaround times overall. I know there are occasional cases where it may take longer, but the median turnaround time for tests in the state of Connecticut right now is 24 hours, and we're getting over 75% of our test results returned in less than 48 hours. So we're performing very well as a state in terms of turning on rapid tests, although I do appreciate occasionally there will be the outliers that we will hear about. But overall, the turnaround time for the PCR test is also among the best in class in the nation.
Okay. All right. Thank you.
NBC Connecticut. The The Associated Press.
Thanks, Max. Hello, Governor. Regarding the change in terms of the 10 and 5, are the other states like Massachusetts and Rhode Island and some of the other New England states, had they agreed to this as well?
Yes. So right now, this is very similar to what Massachusetts implemented a day or so ago. I think New Jersey and New York we're still in discussions with, but I think we're all headed in the same direction.
And then what happens if we end up meeting both of those metrics? Because you have so many people that work in the city or may work in Rhode Island or Massachusetts.
Meaning if we have to quarantine as regards New York and New Jersey, for example? Right. Frankly, right. So we're one region. I think you're going to find it very complicated to say you can't go into New York or New York can't come out here. So I think we'll probably be working together on this. Our positivity rates and cases per 100,000 are very similar, especially if you think about it in terms of the region.
So you don't foresee, like someone that lives in Connecticut and works in New York, and we get to that point where we meet that 10 and 5 standard, that they would be affected by this? They would still be able to cross the border back and forth?
Yeah, we're still trying to figure that out. But obviously at that point, my strong recommendation would be stay close to home as much as you can. We've always had an exception for 24 hours if you have to go into the city for some work-related essential activity. So there'll be ways that we can work around it, but stay close to home if that happens.
Okay. Thank you very much.
CT News Junkie.
Thanks, Max. Governor, as it was initially, the travel advisory had some fines attached to it. Do those remain the same? And also, do we have updated numbers on the amount of people who have been fined under that whole thing so far?
I'll take the first half. Yes. If we have that positivity rate, 10% plus 5%, then yes, you will be fined if you do not willfully disobey the protocols we've got there. We haven't really had to exact many fines, but Josh, do you have any numbers on that?
Yeah, we're at about 45 fines issued, I think, as of last week. And Governor's absolutely right. All of the other requirements are still in place. So you still have to fill out the travel form if you're traveling back from an affected state, attest to your compliance with the rules, which is to either self-quarantine for 14 days or receive a negative test result. All of the existing rules will stay in place.
Okay. How about the other fines, the ones associated with not wearing a mask, not social distancing? I know it was asked before, and it was just sort of suggested that we haven't fined many people. Has there been any substantial amount of those fines handed out yet?
The enforcement there is being handled at the municipal level, and we're not asking the municipalities to report back to us. We had, at their request, conducted some additional training last week on, for local health officials and others who may not be as accustomed to handing out citations about how mechanically to do that. So I think there continues to be a lot of interest across the state. So making sure that tool belt is available for compliance with the public health requirements.
WTIC 1080 News.
Hi, Mr. Governor. Is there still a Monday conference call with all the governors and the remains of the White House coronavirus task force? And if so, were you on that today?
There was not one today. Secretary Azar did it last week since the vice president was otherwise engaged.
What are the other governors telling you, and what are your thoughts on some of the really spectacular numbers you're seeing? Iowa has a 50% 7-day rate. South Dakota's in the 40s. Wisconsin South Dakota's in the 30s. Wisconsin's in the 20s. What about those rates? How did they even? I know they're sparsely populated in some cases, but how did they even get there? I
think in large part people are letting their guard down. I think you saw that as regards to the frustration and the exhaustion with wearing the mask and enough already. Let's let it go. Herd immunity. I don't want to put up with this any longer. A lot of it is related to people are moving indoors. It's not totally unexpected, as you know. You remember Dr. Fauci and Scott Gottlieb and Dr. Cohen, everybody was saying in 1918 you had a second resurgence. In 2020 you're probably going to have a second resurgence. What we've got to do is contain this second resurgence.
Thank you.
The Waterbury Republican American.
Thank you, Max. In terms of the 45 individuals or so who have been cited for violating the travel ban, do you have a breakdown of state residents versus out-of-state residents?
You got that, Joe?
We do. I don't have it at hand. It's mostly Connecticut residents, but we can get you that breakdown afterwards. Yeah.
Okay, thanks very much. And I just want to be clear, Governor, on the new metric for the travel advisory. Is it both those, 10 per 100,000 and a 5% positive test rate, or is it either or?
Yeah, we've gone from either or to both. 10 cases per 100,000 and a 5% positivity. So we've narrowed the lens just a little bit.
And what is it with these thresholds that you think are adequate or yes.
I thought the other threshold was so broad that it was including about 85% of our states across the country, and it was becoming unenforceable. So we thought about, okay, maybe we'll just make this general guidance for all of our states. And then it was, you guys, everybody persuaded me, no, we still have some states, as you heard from the previous question, that have a 50% positivity rate. We don't want those people just to be general guidance. We want that to be enforceable. So that's how we set up with our revised travel advisory.
Okay, and in terms of the daily positive test rate, I realize we generally look at the 7-day, but obviously the daily numbers are important to watch and can be indicative of trends happening. How much is the degree that Connecticut is testing more affecting that rate?
Well, I can start, and then Josh can jump in. Obviously, we're testing a lot more than other people. That doesn't necessarily impact our positivity rate, but it does impact the number of infections per 100,000. And secondly, though, to be frank, the more asymptomatic people you do test, that could affect the positivity rate. Anything else on that, Josh?
I think that's right. I mean, clearly, we're testing per capita far more than most other states, and so we're going to identify a higher percentage of the cases that are out there, both symptomatic and asymptomatic, which is a good thing because then you can act on that. You can have people isolate. You can do the contact tracing. That's how we stop the spread of COVID. But we have seen the positivity rate go up as well. So typically, as testing has increased, you want to see the positivity rate go down. We've seen it go up a little bit. So there's no question that we are seeing more spread in the community. So that's why we need to stay the course, keep testing aggressively, contact trace, quarantine, and isolate.
And Josh Curling, what's the 7-day rolling average? And then it'll be it for me.
With today's data included, it's 1.9%.
Connecticut Public Media. The Connecticut Mirror.
Thanks, Max. Governor, right now, with the current metrics, you're using the 10 positives per 100,000 tested and the 10% weekly average. There are 36 states, Puerto Rico and Guam, where people would have to quarantine after visiting. Has anybody run the numbers to say, with the new metrics that we're shifting to, whether the quarantine pool would be a larger number of states, smaller number? Do you have any idea what it's going to do to the math?
I think, Josh told me that with our new metrics, it'd be 33 that would be on that quarantine list. And the number under the old metric was going to go up probably to something like 40.
That's right, and it's obviously depending on what the states all report today. We haven't seen anybody else's data for today yet, and that'll all get aggregated on all these national sites overnight, and we'll have a clear answer for tomorrow.
Okay. One other question, Governor. You had said a couple times that while there's no hard and fast number, if you see the weekly infection rate approaching or in the neighborhood of 5%, and if it's part of a clear upward trend, that might be the time to rethink things like phase 3 or some of the other ways that society's opened up. But now that we're using 5% as the threshold for travel advisory, is that still the area that you're also using as a guideline, or quite frankly, is 5% too late to consider things like rethinking phase 3?
I think it is a broad number. I think it makes some sense. I mean, as you see what's going on in France and Britain and other places in Europe where they do have a 9 p.m. curfew, and my God, Britain shutting down the pubs at a certain hour. Who would have thought of it? We're not there yet. We still have a positivity rate that I think we've got under control. But to your point, we're going to take a look at it. If you get around that 5-6% range, we're going to have to think about how we can contain this even more aggressively. I don't think we're going to get there.
Thank you.
Hearst, Connecticut Media. The Hartford Courant.
Hey everyone, this is Emily Brindley from the Courant. Governor, you mentioned earlier that there's been some COVID spread among sports teams, and obviously over the past couple of months, you've made pretty strong recommendations that people don't play high-risk sports such as football right now. But given the private football leagues that are playing in various parts of the state, I kind of want to take a step back here. So if you and the State Department of Public Health feel so strongly that high-risk sports shouldn't be played right now, how come you haven't actually banned those sports from being played right now? Why has that been left in the hands of local leaders?
I think what we're, because education and sports, we've tended to treat more locally. But to your bigger point, let's say a month ago, we were thinking about football, thinking about hockey. Do I wear the mask? Do I have a face shield? Will that impact the positivity rate? Is some sports more high risk than others? I think now, a few weeks into this and talking to Governor Baker up in Massachusetts, we're finding it's all the activities in and around the sports teams. That's where the risk is. It's 5 people in a car on their way to that hockey tournament. It's 6 people in a room. That's where the risk is. Does that mean we're going to have to think about doing something with these tournaments where people are coming from far afield? Perhaps. I'm talking to my fellow governors about that. Otherwise, we're going to keep it local. But I would warn you, look, if you have one of these football leagues, we've seen a lot of infections in and around sports. And if that happens on the team, then it gets into the school, then you can't have school open for a while. So there are risks involved.
I guess my question is, if you know that you have seen coronavirus spread in and among sports teams, and, in other areas where you've seen coronavirus spread, such as bars, for instance, which you've had no problem shutting down, why haven't you taken that same approach with sports teams? You know that there's risk there, so how come you've left it up to local leaders instead of just saying, let's eliminate this risk statewide?
Again, I think a lot of these sports can be managed successfully. It's not the nature of the sport so much, but it's all those social activities around the sport. I do think that coaches and parents can take this seriously. They want their kid to be able to play hockey. And I think if they manage it well, you can keep the COVID under control in those situations. And secondly, we've always thought about education in the local sports as more of a local priority.
Thank you.
All right, I'm getting the signal here. Hey, Josh, Paul, thank you. We had a question about the COVID task force, and it just reminded me that 2 people that I really respected on that COVID task force was Dr. Deborah Birx. She was here last week and gave us some pretty good intel, and Dr. Fauci, who maybe you remember, beamed in a month or so ago. And I just thought it was really unfortunate when the president took on Dr. Fauci, said, I'm tired of hearing about COVID, and tired of hearing about Fauci and those other idiots always talking about COVID. He's been a disaster. I think it'd be a disaster if we don't listen to Dr. Fauci, we don't look at these numbers, we don't follow the safety precautions that we know that they work, and that's how we're going to get through this together, and I hope that's the attitude we carry. Thank you, Dr. Fauci.